Hello, I wanted to introduce you to the Women's Health Focal Area. My name is Michelle Hinden, and I'm a faculty member in Population, Family, and Reproductive Health. Our mission is as follows. We use a social and biobehavioral approach to understand global women's health throughout the life course. We apply a gender lens to explore and explain social disparities and inequalities that affect health and the well-being of women in general populations, as well as those uniquely marginalized. Our work focuses on maternal health, women's sexual and reproductive health, and their intersection with physical and mental health. I wanted to highlight that we have a number of faculty who primarily identify themselves with the Women's Health Focal Area, and they're listed alphabetically on this slide. I'm just going to briefly mention who they are and a little bit about what they do. The first is Saifuddin Ahmed. He's a faculty member in PFRH, and he focuses internationally on women and maternal health. Dr. Wendy Bennett is a faculty member whose primary appointment is in the School of Medicine, and she does some teaching in our department and focuses primarily on obesity and diabetes. Dr. Ann Burke is also a faculty member whose primary appointment is in the School of Medicine, and her work focuses internationally and domestically and really focuses on contraception. Dr. Michelle Decker is a faculty member whose primary appointment is in PFRH, and her work focuses a lot on sexual violence and intimate partner violence, and particularly marginalized populations. The next faculty member is me. I'm Michelle Hinden. I'm a faculty member in PFRH primarily, and my work focuses on the intersection between gender and women's health, and particularly reproductive health in low and middle income countries. The next faculty member is Dr. Caroline Moreau, and she's an assistant professor and a faculty member in our department, PFRH, and her work focuses a lot on contraception and abortion, and her work focuses primarily in France and the US. And finally, Dr. Donna Strabino is a faculty member primarily in PFRH, and her work focuses on perinatal and women's health issues, primarily in the US. Listed on this slide are some of the key courses in the department, and I won't give you a lot of detail about them, but you can go ahead and click on the links and look at the details of the courses on our website. But they do focus primarily on women's health, and they focus on both an international and a domestic perspective. And you can take these courses to fulfill the concentration in women's health if you're a master's student, the focal area in women's health if you're a master's student or a doctoral student. Thank you.